So what things can affect your heart rate variability? Well, there are some non-modifiable factors like are you a guy or a girl, because guys are going to have a higher heart rate variability. Now, I'm going to tell you it could be because they have a higher muscle bulk and because they have testosterone and their hormones cycle in a day, where females, our heart rate variability is going to change physiological wise because our hormones are all over the place. This is why when you are pregnant, your heart rate variability goes down because your heart rate's going up, your body's stressed, you're not moving as well. It's a whole thing. So pregnancy brings on a lower heart rate variability. Although when you are postpartum, it will return to normal. Your heart rate variability can go down if you are sick, if you have diabetes, if you have a virus, if you have chronic inflammation, kidney issues, lung issues, pathological disease states can affect your heart rate variability. This is one reason I check it, because I can know I'm about to get sick, because if my heart rate variability is weirdly low, but I know I should be recovered, I know, you know. Environmental, if your environment is exceptionally loud, it can affect your HRV. Do you know, in a positive way, if you get outside in the morning and get the first light on your eyes, this will help the rhythm of your body, which one of the things that you can control for your HRV, which is part of your lifestyle, is get more habit and routine. Help your body by going to bed at a more regular time, by perhaps waking up at a regular time, eating at regular times, and having more of a schedule is helpful for your heart rate variability. Also with the lifestyle modifications would be, I need you to walk, I need you to lift, because I'm talking about your heart rate variability, and one of the ways we will support your heart, and I know this sounds like the 1980s called, but heart health matters. Your heart is a muscle. So if you use your muscles and get your blood flowing and pump that heart, like the weightlifting, or maybe you're going to do a light jog, this is going to help your heart rate variability. Now, our heart rate variability, we want to be high, but high is relative because each person is different. Now, we also don't need to always keep it high, because when we do stressful things, it's going to go low. But the overall theme is we want to be able to have the flexibility to recover, and our heart rate variability is showing our body's way of how flexible am I and how well can I recover from that stressful task that I just did. Don't be surprised that athletes have a high heart rate variability. Young athletes have a high heart rate variability. And as women age, as all people age, it will go down. But it doesn't mean it needs to stay down. I have been asking all my women to show me their heart rate variability, and I will tell you, those ladies that are consistent with their workouts, their heart rate variability is in the 60s, and they could be in their 70s. So it doesn't just mean we have to accept it. We can make improvements. But in my clinic, if I were to give you an average of the women I see that are much like me, I'm a 44-year-old female, most of the women I see coming into my clinic have a heart rate variability anywhere from 20, because they're inflamed, to maybe 70. And on average, I would say people come in with a heart rate variability of 40, and I say, let's watch it for the next 6 months. Let's take a peek and let's see if we can make some changes, like what I just said. And I know that they can see some improvements. Now, another little nerdy thing that I have seen in my patients taking GLP-1s, their heart rate variability jumps up 20 points. 20 points. It's amazing. It's amazing. I suspect it's because GLP-1s decrease inflammation through 4 different pathways, and I believe these people are living their best life because now they don't feel so bad and they're moving more, because the lifestyle modifications that they could do, holy moly, it's amazing. So anyway, these are the factors that can affect your HRV.